Pilonidal disease consists of complex symptoms with presentation ranging from asymptomatic pits to painful draining lesions that are predominantly located in the sacrococcygeal region. Non-operative measures like simple shaving or injection of phenol in the tract may control symptoms without surgical intervention in a self-limiting disease. However, a high recurrence and failure rate of as much as 30% has been reported with such approaches. Now, this is a case of multiple pilonidal sinus disease, wherein you can see two openings on the left aspect while one healed sinus on the contralateral side, and there is a midline pit through which the infection has spread. These midline pits may get entangled with lost hairs, maceration by sweating, and poor local hygiene, lack of regular bathing, etc. So, on injection of hydrogen peroxide from one of the pit, it was seen to be emerging from the two sinus openings on the lateral aspect. Lord and Miller described excision of midline epithelial follicles under local anesthesia followed by brushing of the tract to remove hairs within the granulation lined tract. A lay open method is another minimally invasive technique which can be done on outpatient basis and having a low recurrence rate. It, however, is associated with slow healing. While following Lord and Miller's technique, we modified our procedure by laying open the complete tract instead of brushing it and left the wound open for healing by secondary intention. A diode laser, as you can see that a tuft of hair has been removed from the sinus tract, indicating that it's purely a pilonidal sinus. A diode laser was used to carry out the complete procedure. Many studies have concluded that simpler treatment methods for pilonidal disease carry less morbidity and a low recurrence rate. As the procedure of sinus excision by laser aims at removal of sinuses alone while causing little damage to the surrounding healthy tissue, it can be termed as a simple and minimally invasive technique. So once a fistula probe is inserted into the sinus opening and brought from another opening, it can be laid open with the help of the diode laser over the probe. All the infected granulated material should be scooped out or curated. Contrary to Lord and Miller's technique, laser sinus excision takes a wider skin incision and creates a funnel-shaped wound with removal of the overlying skin. With this maneuver, there is hardly any chance of leaving behind any inflammatory tissue or part of the sinus tract behind. This also prevents forming a dead space under the skin in the early postoperative period, particularly when the buttocks come closer. Now we are opening another sinus tract which is on a lateral aspect and is connected with the main sinus tract in the midline. So now this wound looks like a Y-shaped wound with two arms and a long main tract. It's always prudent to give a liberal incision to the end of the tract because sometimes granulation tissue or infected material may be hidden underneath the topmost or lowermost edges. So removing a little bit or incising a little bit more amount of tissue over the tract, one can always be assured that all the infected pockets have been taken care of. When compared, sinus excision by lasers offers several advantages over the more extensive wide excision and healing by open granulation procedure. The operative time for laser sinus excision is significantly shorter when compared with the wide local excision technique. This is possible because while excising the sinus and the offending tissue, laser device provides a coagulative effect, obviating the need to secure bleeding points. Lasers have been shown to achieve sealing of the sensory nerve endings and leaking lymphatics, the two factors which are supposed to cause post-operative pain. As a large wound is created after wide excision, the wound and the edges become a source of constant pain. But due to minimal pain and insignificant discomfort, the patient operated with laser needed lesser quantity of analgesics. While patients operated with lasers procedure were able to return home within 12 hours of the procedure, the mean duration of hospital in the wide local excision is significantly longer. Because the patient preferred to stay in the hospital due to pain, a large wound, and need for dressing under supervision of a nurse. The patients operated by laser technique are able to join their duties much earlier than the patient operated by other methods. Negligible pain, comfort in performing routine activity, and absence of specific wound care encourage the patients from the laser procedure group to resume duties early. The wounds created by laser heal significantly faster than the wide excision group. This is possible due to significantly small wound created by lasers with a minimal lateral damage. This is evident with a significantly lesser need to change the dressing of the wound. Similarly, wound-related complications like secondary infection and non-healing is rarely observed with laser procedures. After pilonidal sinus laying